So I'm an internist, for example.
Yeah.
And I come to Doctors Aiding Doctors. I come to the website. What am I going to see to help me learn about new types of procedures that I can go ahead and perform in my practice?
Sure. So when you come to the website, you're gonna have access to, well, once you become a member, you're gonna have access to a closed portion of the website where specialists have developed different clinical modules that have a text component and a video component. These modules are developed in collaboration with certain device companies that market the products that the primary care doctors will ultimately use to perform some of these tests. And so you're going to get trained in, number one, the background about these conditions. Let me just take a step back. The purpose of Doctors Aiding Doctors is not to turn the primary care doctor into a specialist. We're not trying to train you to do what specialists do. We're going to give you the background to help identify which patients for which conditions should be appropriately screened in the primary care arena, and then we're going to support you when it's appropriate to refer that patient. So we're not trying to train the primary care doctor to become a specialist. But what you'll get on the site is background information about the appropriate conditions that we've identified. We're going to provide you with the right type of questions to ask your patients to elicit the symptoms that will then lead to the types of diagnostic procedures that we identify and we support. We're going to have step-by-step instructional videos how to do these things. Also, what we provide is any procedure that you're going to start incorporating into your practice, we will only affiliate with companies that commit to physically going with the equipment into your practice for at least a day after however many tests you decide is appropriate to test it for, at no charge. They set up the equipment, they walk you through it, and they're there physically to support you doing it. We also provide support for billing and coding so that you know how to appropriately bill and code for the types of procedures that we're teaching you to do. And another feature that we're really sort of excited about is a feature that we call Ask a Question. And what that does is that makes the board of specialists available to any of our customers at any time. So the primary care doctor sort of working on the corner of Main Street in Nebraska, can see a patient, can be getting involved in a clinical module, have a question about it, simply type their question, click the button, that comes to, a specialist panel who then gets that question and replies directly to that physician. So I think that we're really kind of excited and proud about the level of education and ongoing support that we're able to provide.
Dr. Hines, we have a commercial coming up here from our friends at MediStar, but when we come back, we're going to speak about some of the different subscriber levels, costs involved with joining Doctors Aiding Doctors, and we'll be back in a minute right here on the Healthcare Business Network.
Are you looking for a billing company that can increase your revenue, effectively manage your credentialing, deliver the right software, and provide guidance in navigating the minefield of compliance? MediStar has been providing the right answers for hospitals and physicians for over 13 years. We go the extra mile by paying attention to the details and focusing on aggressive follow-up. Recognized for 4 straight years by Inc. magazine, our professionals can help you attain your revenue cycle goals while helping to ensure that your work is done in a compliant manner. Call one of our experts toll-free at 888-423-8080. That's 888-423-8080. Or visit us at www.medistarbilling.com.